Ladies and gentlemen, welcome to VEP Wellness Tips with Gary and Larry. You and your phones.
That's my go-to right there.
What are we doing today?
Well, we've talked a little bit about what some of the symptoms of burnout are. We've talked about the prevalence, like 75% in emergency care providers. And so I guess the question to you, Larry, is why do we as emergency providers, as physicians, as APCs, why do we seem to be such a setup for burnout?
You ready?
Oh, the light! Wow, Superman, huh?
We're all superheroes, right? So it's like we've all gone through this brainwashing indoctrination period that plays a big part into what we believe, who we think we are and aren't, that we can do everything and we don't need sleep, we don't need days off and all this stuff.
Be tough, suck it up.
That period was called residency or training, right? So I'm gonna go, and these are some of my favorite.
What are you reading there?
So this is the Dyke Drummond book that we keep. This is page 38. Stop Physician Burnout. So he talked about 5 different kind of personality types that feed into burnout, and so many of these apply to a lot of us. Like the superhero. Number 1, workaholic.
Sound familiar?
Yeah, I mean, there's a lot of other careers where that just, it's too much, and this is a great example of one. Superhero, emotion-free, right? None of it should get to you. Should be able to handle anything, death, dying people, a mistake without having any emotions about it. Lone Ranger, I can do it all alone. I don't need anybody. Such a lie. I mean, there's a subspecialist for everything, you know? It's incredible the amount of things, especially in the acuity that we're asked to do. And perfectionist. You know, how much of each of these kind of personality things, which I think are amplified in residency and reinforced, apply to you, and then think about the long-term consequences of that, because reality is we're not superheroes. Kind of, but no, we're human. You know, nobody's perfect. We all make mistakes. You can't do it alone. You gotta have emotion. Yeah. It doesn't work.
That putting one foot in front of another, too, I think is something that leads some people to talk about burnout as your battery being drained.
What do you mean one foot in front of another?
Kind of like an Energizer Bunny, right? As Dyke will talk about it. The Energizer Bunny in terms of just continuing to move along one foot in front of another. But there's a huge problem with that analogy. And what happens to an Energizer Bunny when that battery goes dead?
Well, it just doesn't do anything.
It stops.
The battery dies, right?
Right?
So.
And so it's not a good analogy, because in burnout, we keep going. We keep going day after day, patient after patient, year after year. So it's much more like a bank account that's been overdrawn that you keep tapping into.
Because the ER never closes.
Never closes. You never stop getting called to work, right?
Yeah, you can't just not go to work.
And so you just keep drawing below the zero level. And that's just a really unhealthy thing.
Into the negative.
Yeah, yeah.
And that's burnout. That's part
burnout.
Of burnout.
We talk about being trained in residency in regards to these issues and being socialized in such a way that it leads to burnout. But I gotta say that I think that after residency, I mean, what do you see us celebrating? Picking up the additional shift, seeing the most patients, coming back on a quick turnaround, giving up family stuff to cover for the group. You see us celebrate that stuff.
This is culture.
And that's a culture that can get the job done in the short term, but what's the long-term sustainability of celebrating those things?
Those are good questions.
Yeah.
Those are good questions. They're a little bit threatening.
What other job do you really not even have the option to call in sick to? I mean,
does anybody have sick days in the ER? No.
No.
I don't know how many shifts you've ever. In 8 years, I called in one day. Yep. I remember telling Robbie Cohen I had swine flu because I had a horrible fever.
It took swine flu, right? To get that Superman down.
Yeah, and I still feel bad about it.
Yeah, I can remember. I can remember the one shift that I had truly the flu, that it was like coming in was not one of the possibilities. And I
mean, I probably could, like I could have Superman through it. I wouldn't have been
worse about not making that shift than I did with the vomiting that I was having.
I felt terrible.
So what's the answer to changing the culture? I don't think there's an easy one. Culture is hard to change, right?
Part of it's this conversation. I think it touches a nerve with people, with our providers that know that we can do better.
Yeah.
Yeah.
And
I think there's a long-term vision where when you focus on your wellness and well-being, you're going to be able to do more shifts. We're not going to have providers that have to work reduced numbers. I hope that I have some faith that actually getting in and dealing with this stuff on a individual and organizational level will make us better.
Yeah,
makes sense to me. There was a couple other things I wanted to point out of here that are similar things we learn in residency. This is page 39 for you book people that want to learn more. This is a great resource. The patient comes first always. What do you think about that? It makes sense. It resonates with me, of course, right?
Right. That's what's been hammered into us.
Is it true?
If I can't take care of myself, how can I take care of patients?
It's a hard one. Never show weakness. Same thing, you know it all. You can do it all alone. All of these I think it's a limited mentality. At the end of this chapter, he says, look, it's okay to take care of my personal needs. It's really hard for me to say some of these. It's okay to take care of my personal needs. It's okay to have times when I feel down, when I need to ask for help. It's okay to delegate tasks and not do everything myself. It's okay, there are times when good enough is good enough. Doesn't have to be perfect.
I like one of the sayings that Dyke has is that you can't give what you ain't got. You can't give what you ain't got. And I think just looking at the socialization piece, what we celebrate, what we were trained in, just when you look at it from that standpoint, just makes it so obvious why we have such a high burnout rate. We've been programmed to burn out.
It's it's not a matter of if, it's when.
Yeah.
So if you've been experiencing some of these kind of signs and symptoms and you've wondered, where does burnout come from? Is there something wrong with me? Is it because I'm not good enough for, the shame part?
We have been programmed to burn out.
Yeah, part of it's your programming.
Yeah.
So how do you undo that programming? What do we do next?
I don't know. Stay tuned.
You watch more videos, and we're gonna do our best to help you get from burnout to wellness, because patient satisfaction is important, but so is provider satisfaction. That's why we're doing this.
Good. So we'll see you next time. Be well. You're a precious resource.